morning. How are you doing? Brooklyn, right?
Yeah. What's your name?
My name is Dr. Madsen.
Hi, nice to meet you.
So, what seems to be the problem? What brings you in today?
Well, so about 2 weeks ago, I started feeling a sharp stabbing pain in the heel of my right foot, so I just wanted to get that checked out.
Oh, I'm sorry to hear that. Well, let's see if we can get it figured out for you.
Okay.
I'm just going to start out by asking you some questions just to get a better idea about your overall general health.
Okay.
So, have you ever been hospitalized?
No.
Have you had any serious childhood or adult illnesses?
No.
Are you up to date on your immunizations?
Yeah.
Are you currently taking any medications?
I am taking Tylenol just for the pain, but other than that, no.
Okay. Do you have any allergies to medications?
No.
Have you had any transfusions, blood transfusions?
No.
How would you describe your emotional state?
Good.
That's good. Okay. Do you smoke?
No.
How many hours of sleep would you say that you get per night?
About 8. Pretty normal.
Okay. What do you do for work?
I'm a respiratory therapist.
Oh, that's awesome. How many times a week do you exercise?
About 3 to 5, depending on my work schedule.
Okay. Do you take illicit drugs?
No.
Or have you ever?
No.
How would you describe your diet?
Relatively healthy, mainly like meat, vegetables, and fruits. I don't eat a lot of like sweets and stuff.
Okay. And then do you drink alcohol?
No.
Do you have any pets?
Yeah, I have a dog.
Okay. Are you married?
Yes.
Are you in a monogamous relationship with your husband?
Yes.
Okay. Have you traveled recently?
No.
Then, as far as your family history goes, have you had any? Has anyone in your family had any like congenital illnesses or serious conditions?
No.
Okay. Now I'm going to ask you some questions about the condition that you have.
Okay.
How did it start?
It started about 2 weeks ago. Like I said, it mainly hurts when I'm walking around on it. It doesn't hurt too bad, like when I'm resting like this, but yeah, it just hurts in my heel really bad.
Okay. So you said it hurts on the bottom of your heel.
Yeah.
You would say.
Yeah.
And it's been happening for about 2 weeks. How would you describe the pain? Maybe stabbing, throbbing, aching?
Yeah, it's stabbing and it doesn't really go out very much. It's just kind of localized.
Mm-hmm. And you said that it gets better when you rest. Is there anything else that you can do to help with the pain, or is there anything that you can do that makes it worse?
Just pretty much like sitting and resting as much as I can, icing it, taking pain meds. Yeah.
Okay. And then does the pain spread or radiate, or does it kind of stay localized?
No, it stays localized.
And is it worse in the morning, in the evening, with the first steps of day, anything?
Yeah, it's worse in the morning when I'm first taking steps, and then it gets a little bit better.
Okay. And then how would you rate the pain on a scale of 1 to 10?
When I'm walking on it, like an 8 out of 10, like it hurts pretty bad, and then at rest right now, it's like a 2 out of 10.
Okay. And so now I'm just going to do the physical exam to try and figure out what's going on.
Okay.
First off, we're going to do a vascular exam. I'm just going to observe for any change in temperature as I'm going down. I'm going to check some pulses first. I'm going to check the posterior tibial pulse, which is graded 2 out of 4. And then the dorsalis pedis, also 2 out of 4. Now I'm going to do popliteal. Can I have you scoot back a little bit? Perfect. Okay, so popliteal pulse is also graded 2 out of 4. Okay, perfect. Now I'm just going to check for hair growth, which appears to be normal, slight. I'm going to check turgor elasticity. Okay, that appears to be normal. Capillary refill time under 3 seconds, which is good, which is normal. Now we're just going to do the dermatological exam. So I'm going to have you hand me your feet one more time. And I'm checking for any signs of ulcerations, any open wounds, any dry skin, xerostoses. I'm checking between the toes for any macerations or other conditions. Checking the toenails for any conditions. Everything appears to be within normal limits. Checking the plantar surface of the feet. Slight redness on the calcaneal surface, plantar on the right foot. Checking underneath the legs. Okay, perfect. Now we're going to do the muscular exam. So the first thing I'm going to have you do is I'm going to have you press against my hands in a few different directions. So try and lift your feet. Okay, push them down, push them out, push them in. Perfect. Now I'm going to check some ranges of motion. First for the first ray. Okay, mid-tarsal joint, subtalar joint, and ankle joint. Okay, same thing on the other side. Okay. All of that is normal. Normal ranges of motion. Now, what I'm going to do is something called the Silver Scale test, to test for any equinus. Can I have you scoot back a little bit? Okay, perfect. So now I'm going to check dorsiflexion. Okay. Above 10 on both sides. I'm going to have you lay down and lift up your knee. Okay. Okay, perfect. Lift up this knee. Perfect. Okay, so no equinus present. Above 10 degrees dorsiflexion. Now what I'm going to do is I'm going to do the neurological exam. So the first test is called the Sens-Weinstein monofilament test. I'm going to touch your foot in 10 different points, and you'll have your eyes closed and you'll tell me when I'm touching your toe, okay?
Okay.
So let's close your eyes.
Mm-hmm. Yes. 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 Yes.
Okay, perfect. So 10 out of 10 on both sides. Now we're going to do the sharp dull sensation. So I'm either going to touch you with this, which is going to be sharp, and this, which is going to be dull. You'll have your eyes closed and you'll tell me whether it's sharp or dull, okay?
Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, perfect. Now we're going to do the proprioception test. So you'll close your eyes, I'll grab one of your toes and either lift it up or bring it down. You'll tell me which one I'm doing, okay?
First one's up. The last one is down. The third one is up and down. Second one is up and down.
Okay, perfect. Now we are going to do some reflex tests. So first we're going to do the Babinski reflex. So, okay. Negative on both sides. I'm going to have you hang your knees off the edge of the bed really quick. We're going to do the patellar tendon reflex. Okay. Okay. Achilles tendon reflex. Awesome. Okay, perfect. And now, can I have you lift up your legs one more time for me? Now we're going to do the vibratory sensation.
Okay.
So I'm going to put this vibrating tuning fork on you in 2 different areas, and you'll tell me when you start to feel the vibration versus when it stops with your eyes closed.
Okay. Yes. It went away. Yes. It went away. Yes. It went away. Yes. And it went away.
Okay, perfect. So vibratory sensation is present on both sides. All reflexes are present on both sides. So now I'm going to examine the area of concern, which is your right foot, right?
Mm-hmm.
Okay, so it looks a little bit red, looks a little bit inflamed. Based on what I've seen and what I've heard today, I would say that you most likely have plantar fasciitis. So the plan is today we're going to give you a small cortisone injection to help with the pain and with the inflammation.
Okay.
And I'm also going to send you home with some stretches and some exercises to try to hopefully strengthen that plantar fascia and relieve some of the pain. I'm going to encourage you to continue to keep taking acetaminophen as needed to deal with the pain at the recommended dose. And we're going to schedule a follow-up appointment in about 2 weeks so you can come in and we'll check out how you're doing, okay?
Okay, perfect.
Do you have any questions?
No, I don't think so.
Okay, perfect. Well, it was nice to meet you.
Okay, thank you.